investigators and 1,000 contact tracers. Now I'd like to turn to PPE. Since the beginning of this pandemic, we have worked to build up the supply of PPE in Virginia. We are now at a place where our hospitals have an adequate supply. Our Virginia Emergency Support Team, we also call that VEST, Unified Command, has been responsible for acquiring, tracking, and distributing PPE to users across the Commonwealth. I just want to go over a couple figures. As you know, we've been at this for a couple months, and we started with little to no supplies. So far, we have distributed 793,675 N95 masks, more than 1.3 million surgical masks, more than 3 million gloves, 285,031 gowns, 427,425 face shields, and 24,359 containers of hand sanitizer. I want to explain how this public PPE is distributed. First, the priority for the public PPE stockpile is to support the state COVID response and testing. We have established a robust reporting and distribution network. Our local health departments coordinate PPE needs and reporting from community providers, such as urgent care facilities, freestanding clinics, federally qualified health centers and free clinics, hospice, and more. Our regional health care coalitions coordinate closely with our acute care facilities, dialysis centers, and skilled nursing facilities. Our direction has been that health care providers should exhaust their private supply chains before requesting state assistance. But at the same time, we have been clear that no one treating COVID patients or supporting COVID-related activities like testing will go without PPE. So if a clinic or a nursing home or another provider needs help, we want to provide that help. But we also need them to use the private supply chain first. There are several resources for that, and I want to highlight a few today to make sure that everyone knows about them. The Department of General Services, DGS, has established a rapid review process for vendors selling COVID-19 related supplies and services, and maintains a list at dgs.virginia.gov. I'm going to repeat that, dgs.virginia.gov. Virginia has also worked with Amazon to make sure that organizations on the front lines of the COVID-19 response, including health clinics, doctors' offices, hospitals, and other providers, can get priority to purchase PPE. Additionally, FEMA is shipping some PPE directly to nursing homes. Each skilled nursing facility will receive 2 shipments from FEMA, each with a week's worth of PPE. Again, I want to reiterate that if healthcare providers working to fight the COVID-19 pandemic need PPE, we will make sure they have it. They just need to please let us know. Now I want to talk a bit about healthcare. Since the Affordable Care Act was passed in 2010, there have been efforts to undermine it. But millions of Americans and thousands of Virginians have access to health care because of that law. Since the beginning of this administration, we have worked tirelessly to expand access to quality and affordable health care for Virginians. That is especially critical now during this pandemic, when access to care is so vital. One of my top priorities, even before I took office, was to expand Medicaid eligibility, and we did just that. Since we expanded Medicaid access at the start of 2019, more than 421,000 Virginians. I want to repeat that. 421,000 Virginians have enrolled in coverage, and they now have access to health care that they didn't have before that. And it is clear that there was a great need. Medicaid expansion has allowed these individuals and families to access critical services to treat medical conditions. That includes the underlying conditions that contribute to making COVID-19 so fatal. Since Virginia expanded Medicaid, more than 60,000 people have received treatment for high blood pressure. More than 33,000 were treated for diabetes, 14,000 for asthma, and nearly 10,000 treated for COPD, chronic obstructive pulmonary disease. Access to affordable health treatment is more important than ever during the COVID-19 pandemic, which is amplifying economic, health, and social disparities. We should all be grateful for this expanded coverage so that in this pandemic, those thousands of Virginians have access to the care that can keep them healthy. In fact, since we declared a state of emergency for Virginia in March of this year, almost 30,000 adult Virginians have enrolled in Medicaid through the expansion, and an additional 23,000 children have been enrolled in Medicaid. I am glad that they have access to care, but I know we need to keep working to ensure all Virginians have that access. That's why I'm convening a new work group to continue identifying ways we can reduce cost and improve the quality of health care coverage for all Virginians, regardless of how they get health insurance. This group will build off the work of the Market Stability Work Group I established last year. That group made recommendations that we worked on this past session, including creation of a state-based health insurance exchange and establishing a reinsurance program in Virginia. Both are proven strategies to reduce your premiums. Additionally, I wanted to commend the General Assembly for working with our administration to ban balance billing in the Commonwealth. Now, balance billing is when you see a provider who may not be in your insurance network and you get a bill that is a lot higher than you expected. That has been stopped in Virginia. The pandemic highlights just how important it is for every Virginian to have access to care. Accordingly, I have vetoed 3 bills, Senate Bills 235 and 861, and House Bill 735. Those bills would address health insurance cost concerns for targeted segments of the population, but in doing so would increase the cost of insurance for sicker Virginians in the marketplace. I appreciate the work of proponents of these bills and hope they will engage with the new work group to find more broad-based health care solutions for all Virginians. Our Department of Medical Assistance Services has just received approval of an emergency waiver that will support streamlined access to care in Virginia. I also want to note that Medicaid members have access to addiction and recovery treatment services. This is a difficult time for all of us, but people who are in recovery from substance use disorder face particular challenges. We've heard from localities around the Commonwealth that they're seeing an increase in the number of drug overdoses in our communities. In Roanoke County, for example, dispatchers have responded to twice as many fatal overdoses in the first 5 months of this year than they did in all of 2019. The northern Shenandoah region has also seen a substantial increase in overdoses, both fatal and non-fatal, when compared to the same time last year. As a physician, these reports are very, very concerning to me. While we fight the COVID-19 pandemic, we cannot lose sight of ongoing public health emergencies like the opioid and addiction epidemics. My executive leadership team on opioids and addiction continues their work, making sure people can get access to medication-assisted treatment and to support harm reduction sites. In recent years, Medicaid has seen an increase in the number of health providers who can prescribe buprenorphine. This is going to be a hard one for you. Buprenorphine. Good job, which is frequently used medication for opioid use disorder. And that means access to medication-assisted treatment is more available for people seeking recovery during this health emergency. Anyone who needs treatment or emergency care should seek it. Our behavioral health resources continue to be available. There are services online, for example. Our community services boards have moved some treatment services to telehealth. DMAS has new policies to encourage telehealth for Medicaid members, and that is helping increase access to treatment. Additionally, there are recovery groups that are holding meetings by video or phone call. The Department of Behavioral Health and Developmental Services website has a list of virtual recovery groups.